Okay, hey guys, how are you? We are about to begin. Mire los foquitos, por favor, muy juiciosa. Los dos foquitos. Mire, estos foquitos que están aquí encima suyo. No se me muevan porque después... Listo. We are about to begin this live surgery. This is a nice case because she has really narrow angles, and her endothelium is a little bit delicate. Le voy a poner anestesia, el líquido duele, no se asuste, ¿ya? Okay. So there are a few things, 3% y FR Pro. There are a few things I want to show you. First, I will use Oftase, look, Oftase 3%, which is our Rayner dispersive OBD, okay? And we use only a small amount. And now, underneath, I'm going to use Rayner Oftase FR Pro, as you can see there. And the reason for using FR Pro is, I have two reasons. The first one, I like the viscosity. I like how it pushes my dispersive very nicely against the endothelium. And the second is the viscosity of this OVD is so good that maintains my anterior chamber, which is narrow, which is shallow, very, very well, okay? So now we're going to implant a Rayner Galaxy IOL. So I'm going to try to make a perfect 5mm, very well centered capsulotomy. Okay, so we're going to try to keep our 5mm capsulotomy very well centered. ¿Cómo está el centraje, doctora? ¿Estamos bien? Bien. Okay, here we go. Here we go. We're going to take all the time we need because I want a really, really nice rhexis, perfectly round and perfectly centered, even if we took a little more time. As you can see, 1, 2, 3, 4, 5, I think it's 525, which is what I like, okay? Agüita en la córnea. Okay, there you can see the rhexis, perfectly centered. Mire los foquitos, por favor, mi corazón. Elcita, y si le duele me avisa, ¿ya? Recuerda que yo le pongo más anestesia, es muy fácil, ¿sí? Okay, now hydrodissection. We have to be very gentle with the hydrodissection. Because, remember, with this kind of eyes that are very common here in Latin America, with shallow anterior chambers, we have to be very gentle with the pressure we put in the eye, okay? Okay, so, gracias. Here we have a 30-degree 2.2 tip. I like the 30-degree better than the 15-degree, and better than the 45-degree. I think the 30-degree is the perfect one for multiple reasons. So here we are. Remember, we have our soft shell technique to take care of the endothelium. Surquito. I'm going to make a small trench, it's really a small pit, even if it's chopped. And now we're going to chop with no ultrasound. Okay? One. Because I want to protect her endothelium, which is kind of delicate. Okay? So, no ultrasound, just pure agüita en la córnea. Pure mechanical chop. It's more difficult because you don't have the holding power. But it's better for her cornea. So I prefer difficult and the healthier cornea. Okay? Okay, good. And now we have very nice parameters customized for this cornea. We have 25. We have 25. Our power is set to 25. And our aspiration flow is around 50. And my vacuum, it's around 550. And the reason because of this high vacuum is because it makes my surgery more efficient and I can save some ultrasound. Okay? Now I will stop now. And I am going to repeat my soft shell technique because I want to protect very well this endothelium. So, of phase Rayner of phase 3%, which is our dispersive, and underneath I am going to use Rayner FR Pro. Okay? Pushing my dispersive against the endothelium up. Okay? Okay. Now we come back in. Here we go. ¿Cómo estás, Elcita?
Bien, doctor. Bien.
Ya, mi Elcita bella. Okay. So you can see, agüita en la córnea. We chop a little bit. I try to use the least amount of ultrasound. Even if I am slow, I don't care because I want to protect my endothelium, okay? And I'm using all the things I can use to protect the endothelium. Not only diminishing my ultrasound amount, but protecting with a soft shell technique, with the right OVD, and chopping, no ultrasound chopping. Okay, so now we're going to aspirate our cortex. Okay. Sí, cuando puedas me das el Sinsky, por favor. O el Kuglen, cualquiera. Bien. Porque me estoy demorando mucho. I'm taking too long to aspirate the cortex. But that is because I don't have... Me das el chopper que no me entra el Kuglen y no quiero ampliar. Gracias. Ok, agüita en la córnea, por favor, cuando puedas, no hay apuro. Gracias. This is a rebel cortex. Okay. Okay. Very good. Now we're going to polish the posterior. Agüita en la córnea, por favor, que no veo bien. We're going to polish the posterior. I want my posterior very clear. Okay? Very good. No, es que estaba enfocado en la posterior. It was out of focus because I was actually focused on the posterior capsule. Okay? So now visco sweep. I have showed you before about visco sweep. Visco sweep. Visco sweep. And now I inject the OBD in the capsular bag. And now we're going to inject our Galaxy IOL, which I remind you is not diffractive, but you still have to center it very well. This is why your, okay, very good. Yeah, your rexes have to be very good, okay? Dame un copito, que tengo una cosa ahí que me molesta. Gracias. Ok, mire los foquitos, mi corazoncito. Gracias. ¿Tienes algún dolor, Elcita?
No, no.
Vale. Ok, now I want to... As you can see here, you can see by phase contrast that we still have our dispersive against the cornea. This is how good our Rayner dispersive OBD is. Look at that here. Can you see how am I washing it? It was all the time protecting the cornea, all the time. It's very, very good, okay? Now I'm trying to wash it out. Which a little nice technique I have. Okay, very good. Very good. Okay, and I don't want to come closer to the cornea, of course, because I prefer to leave just a little bit of, dame suero, a little bit of dispersive OBD against the cornea. It does anything to the cornea. Por favor, quietica. I'm using flushes, okay? Dámela ya. Okay. Here we go. This was a very nice trick I just showed you. And we finish aspirating our OBD from the cornea, and it's all perfect. And we center the IOL. It's very nice. Very, very nice centered, okay? Suerito. Now we hydrate the incision. And I'm going to show you how very nicely centered our IOL is, okay? Copito Loreto, por favor. Okay. Okay. Now I'm going to center it here through the paracentesis, centering it very well. Okay, very good. Copito. Okay. Okay, we're good. We're good. Now, fill the anterior chamber. Mire los foquitos, por favor. And there I'm going to show you. There you see. Mire los foquitos directamente. There you can see the spirals of this technology. You can see them with phase contrast, and it's perfectly centered. Can you see them? Can you see them there? No. Okay, quietita el cita. There. There you have the spiral technology in the IOL. Okay? Okay. Very nice. Very nicely centered. You have these two lines. These two lines are because of the capsular bag that was a little bit bigger, but we are okay. Now we check our pressure. We check the pressure of the eye. Check the pressure of the eye. Por favor, quietita el cita, ya estamos terminando. Check the pressure of the eye. We're good. Mira, Alexa. And I release a little bit more of pressure, inject antibiotics, and we're good. Mire los foquitos, por favor. There we go. Very good. Nice. There we are. Okay? Okay. Now we're finishing. Mire los foquitos, cierre los ojitos ya. Okay? We finished. I hope you like it. And see you soon. Bye.